Autism is a developmental, behavioral, and learning disorder. It varies widely in specific symptoms displayed and the severity of these symptoms, but the most severe cases usually become apparent before the age of 3. Sometimes an autistic child may be diagnosed after regressing, losing skills they had started to develop. Some of the more common symptoms include the following: inability to communicate normally, with verbal abilities being underdeveloped, unusual voice intonations or mechanical speech, and an inability to initiate or maintain conversations. A lack of pointing to objects and inability to share interest may be present. They may have limited interest in interacting with others. They may not mimic others or engage in pretend play. They may reject being cuddled or prefer to play alone. In severe cases, children may not respond to social cues like smiling or eye contact. There may be a lack of recognizing or understanding the emotions and body language of others, and they may sometimes show a deficit in their own facial expressions or emotions. There may be unusual interest in making certain repetitive, compulsive body motions, such as rocking or hand flapping. They may be clumsy or have stiff or exaggerated movements. Some repetitive body motions may result in self-harm, such as head banging. There may be an unusual, intense, and prolonged fascination with the motions or appearance of inanimate objects, or an extreme focus on activities or objects around them. The autistic person may have an extreme need to maintain strict, rigid, and unusual daily routines. They may become highly agitated or distraught if these routines are disrupted. They may be easily frustrated and/or show very aggressive behavior. They may show hyperactivity and/or attention deficit behaviors to a great degree. They may have severely limited food preferences or eat food in association with unusual habits. The autistic person may have extreme sensitivity to light, sounds, or touch, but may not sense pain or extremes in temperature. Intelligence and ability to learn may be severely limited, but this is not always true. Many may have normal intelligence, but still experience social and communication difficulties or difficulties in relationships. Because there is a great range in the severity of symptoms, many with autism do not receive a childhood diagnosis, and their struggle with autism may not be recognized until well into adulthood. The wide variety of symptoms and great range in their severity is why researchers call this a spectrum disorder. And some diseases, such as Asperger's, which were previously diagnosed as separate disorders, are now considered to be part of one disease. There is no cure for autism, but as we will see in Dr. Silvia's part of this series, there are some very helpful early intervention programs.